Alright, so this video is going to talk mostly about back pain and some of the initial ways that you want to go about trying to decrease it. So anytime you have pain, typically there's a way that you move that irritates the pain, and typically the opposite direction will make the pain feel better or at the very least not agitate it. So initially when you have back pain, your goal is to find this what we call movement preference, which is the direction that keeps the pain the same or makes it better. Now this is really important if you have any pain that travels down the leg. So we've all heard the term sciatica, and true sciatica is nerve pain that goes all the way down into even the outside of the calf, which would be associated with the lowest aspect of your spine, L5, S1. So we're going to talk about how you would do a self-assessment to see which movements are appropriate for you. Now I will say in general, someone who is probably above the age of 50, 60 years old, they typically respond better to flexing forward, and we'll say that their symptoms are better with sitting, with bending forward, and are worse with standing. People who are a little bit younger that maybe have more of a discogenic or disc-related back pain, they will typically say the opposite. They'll say their symptoms are worse with sitting, worse with riding in a car, worse with coughing, sneezing, and better with being upright, standing, walking around. So we're going to talk about how you kind of assess yourself with these movements. So starting off, we have two options. We have one where I'm standing. Now in standing, there's a little bit of a load on my spine, right? Because I'm not being supported by anything. Versus if I'm laying down or on my hands and knees, I'm being supported by that laying down surface, so there's less pressure. So I would say if something is really irritated, the safest place to start is going to be in these supported positions I'm going to go through first. So initially, if you have back pain, especially if you have back pain with leg pain, you're trying to find a position or a movement that makes it feel better. So if I start off on my hands and knees, looking at flexion, if I take my butt back towards my heels, this is flexing my back. And the goal is not to push through, because if my back is sore, all of these movements, if I push to the extreme, may be painful. But you want to see if one feels better than the other. So I would start off by saying, okay, how does it feel as I take my hips back towards my heels? If I go right to that edge where I feel pulling or discomfort, as I do it, does it get better? Does it get worse? Or does it stay the same? I'm looking for the answer to be that it stays the same or it gets better. So I would do this 5 to 10 times to see what happens. Okay? Then I would go ahead and compare that to laying on my stomach. Now one important piece is going to be, if I do that once and it hurts a lot, and I'm doing it a couple times and it's getting worse, don't continue to do it. Once you find that something's irritating, you don't have to continue to do it, it'll probably make it worse. Now, come down on my stomach, I'm going to do the opposite. So starting off laying flat, I'm going to just lightly press up onto my elbows. And same thing, as I do this, does the pain get better? Does it get worse? Does it stay the same? So I'm looking between these two positions to try and pick a preferential motion. If I find one that feels better than the other, that's the one I'm going to do. Now the other option, if this hands and knees or this on the stomach doesn't work, the next piece will be looking at something into rotation. So laying on my side, beginning maybe with my knees up in front of me, I would start off by just taking my upper torso, head, neck, and shoulders, and rotating back. And same thing, does it feel better? Does it feel worse? Does it stay the same as I do it? Do I feel like I can go further as I do it, which would be a good thing? And I would obviously compare this to laying on the opposite side. And you can see that I bring my knees up and I rotate. So between these three motions, you want to try and delineate one is the worst out of the three, which I'm not going to do, and one is maybe the best out of the three that I'm going to do lightly, just short of pain, just lightly moving in and out of it. And that's where I would typically start with back pain, with the goal of, if I had to pick which one of these is most important versus least, I would probably start off with trying the one on the stomach as being one that typically helps people, especially more of a younger, below the age of 30 to 40. But you want to find one of those three that seems to feel better, and that's the one you start with, and you do that a lot. You can do that anywhere between 10 to 15 times every hour if you were able to. Obviously laying down, that's not easy to do, but if you have an acute episode of back pain, that's a good place to start. The next video we're going to talk about some weight-bearing positions that are going to be a little bit more challenging than this. They're also looking to find that movement preference. But at the beginning, you want to start non-weight bearing laying down.